Morning, Joseph. Lovely to
Morning.
meet you.
Good
Thank
to
you
meet
for
you.
coming in here to see me
Thanks
today.
for seeing me.
Okay, tell me a little bit about why you're here.
Well, I'm unhealthy. I'm overweight. I'm lethargic. I don't have time to do any exercise, and I've got a lot of health issues. Just not well.
Okay, so you're not feeling great. You've got some
No.
health things. You're feeling like you're carrying too much weight.
Yeah.
And it sounds like you want to exercise.
I do. I'd love to.
Okay.
I'd love to.
So what's stopping you from exercising?
I just work long hours. I work
Okay.
long hours. There's no time in my life to exercise.
Okay, so you want to exercise. You want to have the energy to exercise, but you're just frustrated that you can't find the time.
Yeah.
Okay, all right. Well, why don't you? Well, let's start there. Why don't you firstly just tell me a little bit about your home life, your work life, and like your day-to-day activities.
Yeah, I've got a really supportive family. I'm married with 2 children.
Great, boys, girls,
2 boys.
and their ages.
They're teens. They're 15 and 13.
Okay, keep you busy.
Yes, they
Active?
do. Well, I wish they would keep me active, but no.
Okay.
They keep my life busy. I work hard for them. I work in a fast food, manage a fast food place. Long hours.
What sort of hours would you be doing there?
8 to 6.
8 to 6. How
yeah.
many days a week?
Well, 5 days, but I get called in on weekends to do shifts.
Oh, okay. So
Yeah.
if they're short on
Yeah,
short on staff, it's you?
I'm the manager,
stops
so
with you.
stops with me.
Okay. All right. That must affect your planning and everything for weekends as well.
Oh, yeah. You can't plan anything. So.
What sort of things do you like to do in your leisure time?
Well, what leisure time is there? I don't really have much.
Okay. What would you like to do in your leisure time?
I'll spend more time with the kids, play around a bit more with the kids.
Are they pretty active and sporty?
Yeah, they love their sport. They love their
Okay.
sport. And that makes me feel a little bit worse because they are so sporty.
Okay, you wish you could participate with them in the backyard a little bit more?
Yeah, and I'm probably not setting the best example for them either.
Okay, all right, fair enough. Okay, awesome. Now, let's just have a chat then. You mentioned that you've got some health concerns
Yeah.
and that your lack of physical activity may also be impacting those.
Yeah.
Okay, well, let's just have a little chat about those first. Can you tell me a little bit? I see you filled in some information for the nurse outside and provided her with those blood test results, which is really fabulous. That's really helpful for us to get a start on understanding where you're at so that we can prescribe something really effective that's going to be the best for you. So importantly, first up, I see you have kidney disease.
Yeah, I do.
Okay, now when I just look at your pathology results here, we have what, we kind of would call about a stage 3. So with the kidney disease, what we do, we block it into yellow, orange and red bands, okay? And we have an action plan for each of those. So you're sitting pretty much in the orange band at the moment, okay? So somewhere in the middle. You've started to progress, but you're certainly not right down in the in the end stages. Are you seeing a nephrologist at the moment?
I am, yeah.
You are? Okay. Well, that's really great because it's actually quite early to be seeing a nephrologist in here. So you're right on top of getting, the best clinical advice that you can at this stage. For where you're at, there's a few things that I can talk to you about that exercise can then help you with. So what we would aim to do with you at this level is to reduce the progression of your kidney disease from going into that red zone, if you like, or slow it from going into that red zone. And also at this point, there's also a cardiovascular disease risk that does come into play. And being an Aboriginal person, I'm not sure if you're aware, but there is unfortunately genetically just a higher predisposition for both kidney disease and also at this stage for cardiovascular or heart health risks, okay? So, no, we can't do anything about that, obviously, but there certainly are a number of modifiable lifestyle factors, and exercise is one of them, that we can use to help you in those areas, okay? Now, the other thing that I see here is that you have type 2 diabetes, and it seems that, would it be fair to say that's not really under control at the moment?
No, it's not.
Okay, now I've only got I don't have a fasting blood glucose, but the blood glucose that we have at 12.6 is really high.
Yeah.
I'd probably send you back to get a fasting result just to get a tighter feel of exactly how that's sitting.
Yeah.
But your HbA1c is also very high. It doesn't mean much to you at the moment, but I can just tell you it's also an indication that we don't really have that under control.
Yeah.
Okay, now what sort of I'm assuming you're on some medications for your type 2 diabetes?
Yeah, I was on some tablets. and now
Yep. Do you remember the name of those tablets?
Metformin.
Metformin.
That's it. Yeah.
Okay, so you're on the metformin, and
Yep.
that's changed, has it?
Yeah. Well, I'm now on insulin
On
injections.
insulin? The injection. So is it a syringe or a pen?
Syringe.
It's a syringe.
Yeah.
Okay. Now, okay, you're on the insulin, but it's still quite high. How are you finding those injections?
Well, I'm not the best with them. I'm not very regular.
Okay. All right. So you're not taking them as often as the.
No, not as prescribed. I try to, but it's just hard.
All right. Now, it's really important. Now, I'm sure you know this. It's really important that you're compliant with all your medications. Yeah. Okay. And that could be a reason why your type 2 diabetes isn't under control at the moment. It is quite high. Now, what I can do is I can actually I'll go back to your GP and just let him know what we're doing here, and I will mention, with your permission, that you haven't been taking your insulin as regularly as you should. But I'll suggest there's an option with a pen. I don't know if you've heard of that, but you can also take insulin by a pen, which is a much easier mechanism. So you know, there is a lot of evidence to support as well that people who have the pen are much more compliant with their medication. So we might get your GP's advice on that being a potential option to help us there. But we can also do some exercise, and I'll discuss that in a little while. Now, your hypertension, which is your high blood pressure.
High blood pressure.
Okay. Now, the nurse took it here this morning, and it was 155 over 95.
That's fine.
A little anxious at all when
No,
she was
no
doing
more
that?
than normal.
No, you're feeling quite relaxed.
At the
Okay.
moment.
Is that pretty much what it normally is? Does it normally sit around there? Okay, all right. That is quite high for what we'd like, especially with your diabetes. We also like it to be a little lower than the normal range. Now, are you taking any medications for that?
I'm on an ACE inhibitor.
Okay, all right. Now, the ACE inhibitor, it makes total sense because the ACE inhibitor is often used to control hypertension, and it's often used as a first-line therapy for people with kidney disease like yourself, because it actually has a protective mechanism for the kidneys.
Yeah, right.
So it doesn't surprise me at all that you're on that. Do you take that? Are you compliant with taking that? You are. Okay. Now again, since you are being compliant with your medications here, and it is still uncontrolled, I'll just go. I'll just have a chat to your GP again and just let him know the value that we found with your blood pressure here today, and just seek his advice on whether you might need another medication in addition to that. There are some other medications called beta blockers or diuretics. I'm not sure if you've heard of those. They're also commonly used to reduce the risk of complications associated with long-term hypertension, and they've been found to reduce the risk of heart failure among kidney disease patients. So there might be an opportunity for your GP to explore that, but we'll have a chat to him about that. Okay, so they're the major health. I think I've got a good grip of what your major health issues are at the moment. It's important to understand those because they will affect the exercise prescription that we give, okay? Because there's certain exercises or certain types of exercises that can certainly help you with that. Now I see up the front as well, you started to fill out what we call a pre-exercise screening tool for me. We get everybody to fill this out, and it's just to assess any risks that we need to understand before you begin a program, and what level of intensity we can set, and also if we need to go back to the GP to get further advice before we start a program.
Yes.
So if I can just run through this quickly and make sure that I've got everything down here okay. The first one is around heart conditions, and we know that you have hypertension. Okay, so that's our first yes there. Have you ever had any unexplained pains in your chest, either at physical activity or rest? No. Great. Dizzy spells, feeling faint at all? No. Any asthma? Any history of asthma attacks? Nothing. We know you have your type 2 diabetes. Have you got anything that you know of in terms of muscle, bone or joint problems that could be an issue with exercise?
Not that I know of, no.
Not that you know of? Okay. Any other medical conditions? We can probably put your kidney disease down there, okay? Because that will impact what level of exercise we can do. Now, our instructions are that if you answer any of those questions as a yes, we send you back to your GP just for clearance before you undertake any activity. So we will do that today, okay? But just moving further along, just to get some more detailed information which will help us, just confirming you're 47 years old, you're male, There's no history of heart disease, is that correct, in the family?
No.
Okay. With your diabetes, just out of interest, is there any history there?
Yes, my father lost his leg.
Okay.
Yeah, he had it amputated.
He was okay. He had an amputation, so I guess that's weighing a little bit on your mind, is it?
Oh, it is, yeah.
It is,
well,
yeah. Yeah. Okay. Are you a smoker?
No, I haven't been for 2 years.
Well done.
Yeah, I
Good
think
on
so.
you. You know, it's such a good thing to hear because if you for a smoker, it increases the risk of all of those heart disease and also the progression, your hypertension, your kidney disease. So to have quit 2 years ago is fabulous. So I highly commend you for that. Well done. What about alcohol intake? Just where
not that regular. Probably once on the weekends, occasionally socially. It's not.
Okay. Now
I used to be more regular.
I will tell you that, especially for your kidney disease, it's preferable for you not to have any alcohol. If you have cut back significantly, I'd say that's a good start. Okay, what sort of how much exercise or physical activity would you say you do per week?
Very little.
Very little? None? None outside of work?
None outside of work.
And we measured you at 178 centimetres and your weight was 110 kilos today. We know you have high blood pressure. We can see from the bloods that you brought in today that your cholesterol is also high and your blood sugars are high. Okay, now looking at your height and weight, that gives us a BMI of 34.7, which I don't think it's going to be any surprise to you, but it puts you into an obese category. Okay, and that weight that you're carrying around the abdomen, and potentially if it's also visceral fat, which is fat around the organs, is also a risk for your heart disease factors as well. So that's something we keep in mind for our exercise later on. But here we've got 1, 2, 3, 4, 5. We've got 6 risk factors in what we call stage 2 here. Have you spent any time in hospital in the last 12 months?
Oh, no.
No? We know your medications. Anything other than the ACE inhibitor and the insulin? Perfect. You're obviously not pregnant. And any muscle, bone or joint soreness at all? No. Okay. All right, so we know we've got your BMI, your waist girth was 118 centimetres. Okay, again, goes along with that when we talked about the abdominal fat. That's higher than we would like it to be for you. Your blood pressure we know was high. Your cholesterol was really high, and that's also a combination of your good cholesterol being a bit low and your what we call your bad cholesterol being high. And your triglycerides were also high. We don't know your fasting blood glucose. We'll go and get a measure of that. But we've got 1, 2, 3, 4, 5, 6. We've got 7 risk factors there. So it all really just confirms that we need to get you back to your GP for clearance before we do exercise. Now, on the positive side, exercise is going to help you. Exercise is going to help you with not only your health conditions that we've discussed today, but it's going to help you feel better. It's also going to help you with your mood. It's going to give you your energy levels up. It's going to get your weight down. We're in a bit of a vicious cycle at the moment with the sedentary behaviour, leading to lethargy, which is causing, your diet, as you admitted, isn't good. Now, with your diet, you are seeing a dietitian, I hear.
Yes, I am.
Okay, but it's not really working out for you, finding it hard to stick to?
Yeah, just with my work and everything, the time.
Okay, so it sounds like you know what you should be eating, but you're just finding it hard to find the time to prepare those meals.
Yeah.
Okay, so you've obviously got a very supportive family. I would suggest, and I'm happy to write a letter to your dietitian if you like, that you pop back and see your dietitian, maybe with your wife. I think you need to have a discussion around the fact that you need tools to help you manage your time in preparation.
Yep.
And also ideas for quick meals. Okay, you know what you should be eating. So let's maybe have a chat about meals that you can perhaps prepare on the weekend and then bring out during the week, or meals that are really quick to prepare, and some staples that you could have in the fridge or the cupboard that would be easy for your wife and yourself and even the boys to prepare healthy meals. Okay, because it's all going to really help you. Now, just to bring it into perspective, your exercise is going to help all your conditions, okay? Immediately after exercise, in terms of your diabetes, okay, it's allowing for glucose uptake for the body, okay, and that's going to lower your blood glucose levels following your exercise, which will improve your insulin sensitivity. It improves your blood glucose over time, and positively, it can also lead to a reduction in the daily dose of insulin that you need, okay? It's going to reduce your body fat mass and increase cardiovascular function, which is also going to help your kidney health, those factors. And with your kidney health, it can also reduce your inflammatory markers, which are things that will impact the progression of the kidney disease. All of these things are going to help your heart, increasing your cardiovascular fitness, your blood lipid profile, your fat-free mass, are going to reduce those risk factors for heart disease. And there are indications that the more exercise you do, the lower that risk will be. There's a really strong correlation between mood and exercise. Now you find that with exercise, if you can achieve your exercise goals, it gives you a feeling of accomplishment and helps motivate you for more exercise. And then when you start to see the benefits of that through your weight loss and your energy levels, your improvements in your health conditions, it again increases your mood level. And we just got to get out of this vicious cycle and start a new healthy cycle, if you like.
Yeah.
Now your cholesterol, it's not going to do much for your cholesterol. That's really going to come down to your diet, but it can help put a lid on that bad cholesterol and stop that from increasing any further. Okay, so what I want you to start with is just to start by, if I can ask, is just try and walk to work. You said you only work about a K and a half from home. Okay, maybe not twice a day, but if you're going to get a lift one way and then walk the other way, that's really going to help you. If you can do that 3 times a week, that's a bit. We want to build up to about 30 minutes a day, 3 times a week of walking at this point, and then a little bit of resistance work twice a week.
Oh, okay.
We want to increase your heart rate gradually and increase the intensity over time, but it's really important with where you are now that we start slow, and we also start with some supervised sessions once we get beyond this walking, maybe supervised sessions in the gym. You mentioned that you wanted to get back into the gym, until we get to a point where you're able to do it more or autonomously. So do you feel comfortable with that?
I mean, walking to work is easy. I should be doing that.
Okay.
I should be doing that.
Let's get that underway.
And it's something I can tick off and do it.
All right. Well, let's put a plan in place. Let's say we walk to work as often as you can between now and the next week when we catch up again. You'll pop back to your doctor and just have a chat again about the health issues and the exercise, and I'll write to him and just let him know what we're planning to do to get some feedback from him. And also, the next appointment that you have with your dietitian, take your wife along, and I'll write to her as well and just explain that she could develop some tools for you to assist you with meal preparation as well to help you in that path. But I'm sure we can make some great progress here, and I have no doubt with your levels of motivation that you're going to be able to see some great benefits. So thank you so much for coming in, Joseph.
Thank you
I'll
very much.
see you next week.
See you
Thank
later.
you.